Hi everyone, in this video we will discuss about the principles of pediatric surgery. So before starting the video you have to know about what is pediatric surgery. So it is the medical specialty that focused on the surgical management of infants, children and the adolescents up to the 18 years of age, and sometimes it may extend into the 21 years age. So it deals with the treatment of different types of congenital disorders, different diseases and the injuries that affect the pediatric populations. So let's talk about the principles. So first of all, the pediatric anatomy and the physiology is different in adults and children, and because the size and proportions are different in the children, organ development is different because the lungs, if the lungs, kidney, and they are not mature at the birth and they develop as the age grows. Then the bone development is also occurring in the children because the children bones is flexible. Then the dental development is going on, so it is important in the maxillofacial surgeries. Then let's talk about the system. So in immune system is very weak, so they are prone to infections. Respiratory system is different in the children's, their respiratory rate is different. Then the cardiovascular system is different, in which the blood pressure is also different. Nervous system and the brain is growing in the children. Gastrointestinal system is different. So these systems are the basic concern before the surgery. Then the thermoregulation is also important because the children cannot maintain their temperature and they may go into the hypothermia. Next, the body and water composition is also necessary because the children may go into the dehydration condition. So you can see in this picture, in the infants the width is greater than the length, but in adolescents height is greater than the width. And this is the respiratory system, in which the children, in which narrow nostrils is present and the loose teeth is present. Next, let's talk about the pre-operative evaluations and preparations. So in the children, fasting instructions are necessary for the 2-4-6 rule. So 2 hours for the liquids, 4 hours for the breast milk and 6 hours for the solid foods. So this is necessary. Then their children are first on the OT list and they have to operate it first because they cannot tolerate the fasting. Next, the third one is the children friendly environment is created. Then the collaborative care is also necessary, in which the multidisciplinary approach is necessary, in which the anesthesiologist and the different types of surgeons are also involved. Family centered care is also important. We have to tell the patient family about the risk and management. We will give the emotional supports because their families are very anxiety or the stressful condition. Next, let's talk about the anesthesia and the pediatric surgery. So the anesthesia is very important because the age and size variability occur in the children, and their organs are immature and they cannot tolerate the or excrete or metabolize the drugs. So airway management is also important because airway management, a patient has a narrow airways and the emergence and the recovery may be prolonged due to the immature organ systems. Then the IV access is very crucial and very difficult because the children cannot cooperate. So therefore our trained staff is also necessary. Temperature regulation also occurs because during the anesthesia patient may go into the hypothermic condition. So positioning of the patient is also necessary because the bones are very soft and the nerves may be compressed if the proper positioning is not maintained. Next, specialized training is also necessary. So this is the anesthesiology. Next, let's talk about the surgical instruments because the size of the patient, pediatric instruments may be small like the forceps, pediatric retractors and the needle holders. Then the pediatric laparoscopes are the specific designed for the children, and a varus needle also, and the pediatric endoscopes and the biopsy needles, they are also designed. Then the pediatric anesthesia machine, which is also designed, endotracheal tubes of pediatric sizes, pediatric positional devices like cushions. Then the pediatric imaging equipment like the ultrasound or the X-ray small probes. Then the pediatric orthopedic instruments are designed. Then the cardiac instrument like the vascular clamps. So these are the specific surgical instruments for the pediatrics. Next, talk about the surgery. So minimal invasive surgery is preferred in this children because and there is specialized training is required because the anatomical and physiological differences. Then the safety protocol is necessary because sterilization is proper used, then the perioperative fluids and electrolyte balance is necessary. Patient may go into the dehydration condition, and the minimal invasive surgery benefits are the reduced trauma, shorter hospital stay, and the fast recovery of the patient, less chances of complications, and the improved cosmetic outcomes. So these are the some of the benefits. Next, let's talk about the common surgical procedures which are performed in the surgical departments. First of all, the appendectomy for the acute appendicitis. Next is the hernia repair for the inguinal hernia or the umbilical hernia. Circumcision is performed in different categories. Then if we talk about the ENT, so tonsillectomy and the adenoidectomy is also performed for the tonsillitis or the enlarged adenoids. Cleft lip and the palate is also surgery is performed. Then if we talk about the cardiac surgery, so cardiac surgery for the congenital heart disease like the tetralogy of Fallot, ASD, VSD. Then the orthopedic surgeries were performed like the limb deformity correction, club foot correction. So these are the some type of surgeries. Gastrointestinal surgeries that tracheoesophageal fistula repair or the intestinal or the bowel resection. Urological surgeries for the hypospadias repair or the undescended testes. Neurosurgical surgeries like the brain tumor surgeries or the hydrocephalus. Next, let's talk about the ophthalmic surgery for the strabismus or the cataract removal. So let's see some of the disease picture. So this is the inguinal scrotal swelling. It may be into the inguinal hernia or the hydrocele. Next, this one is the true phimosis in which the foreskin of the penis cannot retract. And this is the hypospadias in which the hooded foreskin and the ventral urethral meatus is present. Next, let's talk about the tracheoesophageal fistula, which is the congenital disorder, and this is the X-ray of the chest in which the left-sided congenital diaphragmatic hernia is present. Let's talk about the different types of gastrointestinal surgeries for the mucus diverticulum containing the gastric mucosa, and this is the gastroschisis in which the gastric foregut is prolapsed from the umbilical near the umbilical openings, and this is the colonic scopic juvenile polyp which is pedunculated, and this is the double duplicate colon along with the two appendices. Next is the ethics in the pediatric surgery. So it is very important to take the informed consent and tells about the risk and benefits of the surgery. We may give the psychological support to the families. So post-operative pain management is also necessary for the comfort of the patient, long-term impact of the surgery, and we will minimize the harms during the surgery or the post-operatively. So multidisciplinary collaboration is needed as we already discussed, and the confidentiality and the privacy is also important. So these are the some of the ethics. Let's let's talk about the future trends or the advanced technologies which are occurring in the pediatric surgery. So first of all, minimal invasive robotic surgery is performed for the different types of complex surgeries. And next, the image guided surgeries are also performed under the MRI CT scan guided, and 3D printing surgeries are also performed which helps in the complex surgeries like the orthopedic or the cardiac surgeries. Then the surgical stimulation and virtual reality surgeries are also occurring, and the single incision laparoscopic surgery is also performing. Next, let's talk about the transplantation innovation in which the liver transplant or the kidney transplant innovations are also occurring. Then the non-invasive prenatal diagnosis or the fetal surgery is also performed to prevent the congenital disorders during the pregnancy. Next, the tissue engineering and the regenerative medicine is also important for the diagnosis or the treatment of congenital disorders. And there is a new technology of the nanotechnology in the drug delivery in which the target drug therapy is given, which reduces the systemic effect and act on targetedly on the system. Then the telemedication or the telemedicine teleconsultation is occurring in which the remote access to the undervillaged patient or the patient is given. Next is the last is the hybrid operating rooms are also designed in which the combined catheter based interventions are also performed. So these are the some of the future trends which are occurring in the pediatric surgery. So I hope this video is very helpful for you. If you have liked it, please share it to your friends. You can subscribe our channel for more such videos. Thanks for watching.